You guys tell me, do you want me to kind of jump in on an update, or do you guys have questions? That
I have a number of questions. We're going to introduce the rest of our delegation real quick,
Great.
and then we'll jump into questions. As we get started on that, I just wanted to say, first off, thank you to both of you for being with us tonight and for the great work you're doing. And a huge thank you to our healthcare providers across our country and in Virginia. You've just been doing amazing work, keeping, caring for people through this pandemic. And then on the rollout, I know there were some initial challenges, but I'm so proud of the work you've done. Tell me if I'm wrong here, but checking the numbers today, we're now in the top 10 nationwide on vaccinations. Over 1.5 million vaccinations we've given here in Virginia, which is phenomenal. I was trying to compare with other states of similar size, and we're beating all of them. And we also have 2.6% of our population has already received 2 vaccinations. So really phenomenal job that has been done by this. So with that, let's start off. I'm just going to go from the top right of my screen. And since she sits next to me now, I got to make her happy. Senator Jennifer Boysko, please introduce yourself and your district.
Hi, I'm Senator Jennifer Boysko. I represent the 33rd Senate District. That is the eastern portion of Loudoun County and the northwestern portion of Fairfax County. And I'm so happy to be here with you all tonight.
Thank you so much. And this, by the way, I thank all the legislators for being here. This shows how important this topic is to all of us. The next is my former seatmate in the House. And I love her and miss her, Delegate Kathleen Murphy.
Hi, I am Delegate Kathleen Murphy, representing the 34th District in the House of Delegates. And the 34th District is McLean, Great Falls, and parts of Loudoun County. All of the good parts, of course. And thank you for having us here for this conversation. It's an important conversation. Thank you so much.
Okay, and then I will go next to Delegate Karrie Delaney, please.
Hi, good evening, everyone. Thank you all for everyone here with me for hosting this together so that we can offer this opportunity for all of us to learn. I appreciate our doctors for being here. I appreciate all the hard work that you and all the public health professionals and all of the hospital and healthcare professionals are doing for us during this time. I'm Karrie Delaney. I represent parts of Fairfax and parts of Loudoun County. I'm really excited to listen and learn tonight and look for ways that, we can continue to work together and that I can be of service to make sure that, we're getting on the other side of this as fast as we can. I've got 2 kids in school that are virtual right now, so I certainly understand the urgency that many of our families in the community are feeling right now. And I think some of what we're hearing about, getting the numbers with the vaccines where they are, I'm really optimistic that means we're on the other side. And I hope that we hear some information tonight that is encouraging. But thank you for being here.
Perfect. Delegate David Reid, if you could quickly introduce yourself.
Yes, thanks, Senator Bell. So I'm Delegate David Reid, and I represent the 32nd District, which is the eastern portion of Loudoun County. And I'm really grateful to have Dr. Avula and Dr. Goodfriend here tonight to be able to directly answer questions from our constituents, because it's really important, I think, for them to be able to hear directly from them about what have been the accomplishments and what are still the challenges ahead. So I thank them for doing this, and thank all of my other fellow colleagues for all the hard work that we've been putting in to be able to make this possible. So thanks very much.
Okay, and last but certainly not least, and the person with the most beautiful background and always smiling, Delegate Wendy Gooditis.
Thank you, Senator. And again, thanks to everyone for putting this together. My name is Wendy Gooditis. I represent House District 10, which includes Leesburg, a chunk of Brambleton, Middleburg, and points west until as far as Interstate 81. I am in awe of the healthcare workers who, coming on up to a year now, are giving their hours, their days, their sweat, their blood, and even their lives to work for us and keep us, well, get through this pandemic. So thank you so much, all of you.
All right, well, we'll get started with questions. Let's see. I'm going to go ahead and do the pre-questions. Senator Boysko, do you have the ability to open up chat? And if you could open up chat, I'll do questions I've got from the coming in first, and I'll rotate to you for the next one so we can kind of rotate between them. Does that work? I don't know if she's frozen or not, but let's keep going. Okay, first question. How can I find out when I registered for the shot? I want to make sure that a husband's registration went through, and when can they get shots at Walgreens? So really the real question is about when can they find out about registration, and how can they follow up once they've registered?
Yeah, and I could take that because we've had a pre-registration process in place for about a month now. And so we've had probably a total of about 100,000 folks that have submitted registrations, and that may be about 60 to 70,000 unique residents of the county. And we understand that there's a good amount of frustration with having to wait for the vaccine now that it's here, and also not knowing where people are on the list. So what we try to do is get information out to all the people on the list, at least on a weekly basis, just to let them know that we know they're still there. But at any point, people can either call 703-737-8300, which is our coronavirus hotline, or email at health@loudoun.gov, and we can verify that you're that you did submit a survey, that we do have it, and where you stand compared to where we're able to offer appointments through the county's vaccination site. So again, just email us at health@loudoun.gov with your full name, and particularly what we find sometimes is that some people go by different names. The name that you remember being the one that was submitted when you did the registration, and your email address, and we'll get back to you and let you know, one, that verifying that you are online. And what we're better able to do is say, well, we're on day, like for example, today we're up to day January 13th for people who had registered online. It's harder to say how many days it will be before we can offer someone a vaccine, because in part that depends on vaccine supplies that come in and what category someone is currently in. Because as folks know, under the governor's direction, we give 50% of the vaccine that we have available to those age 65 and above, and the others 50% to the other categories of folks in 1A and 1B.
Dr. Goodfriend, Senator Bell, could you just repeat that number again slowly? I saw some stuff coming up in the chat.
Yep, I'll tell you what, Dr. Goodfriend, we won't take your time. I'm going to have Aaron post that in just a moment on the chat, along with other contact information. We see real quick before we go to our next question, Senator Barbara Favola has joined us. If you could quickly just tell us, introduce yourself, what district you represent, please.
Thank you, John. Appreciate it. Happy to join you all. I'm State Senator Barbara Favola. I do have a district that covers parts of Arlington, parts of Fairfax, and parts of Loudoun, the Algonquian area primarily. So I'm delighted to be here, and thank you, Senator Bell, for organizing this.
Well, thanks all of you for being here. Next question, I'm going to jump right into it. This is probably a Dr. Avula question, but of course, please jump in. In regards to the vaccines that have been approved, is it safe or dangerous to receive more than one shot from different companies, for example, a Pfizer and then a J&J, in order to obtain over 100% efficacy for more protection? Reason being, since none of the vaccines have 99 to 100% efficacy and their efficacy range is below 80 to 95, I was wondering if you can get over 100 by combining different vaccinations.
Yeah, well, the vaccine platforms work slightly differently. So the Johnson & Johnson vaccine versus the Moderna and Pfizer vaccine. So there's not really an additive effect. And I think that there are currently studies being done around the interchangeability. So if you start with the Pfizer vaccine and potentially get a second dose of the Moderna or vice versa, because both of those are built on the same platform. But there's not really the option of having over 100% protection by combining different doses. Right now, there's the Moderna and Pfizer. Johnson & Johnson is going up for FDA authorization on February 26th. AstraZeneca, probably a few weeks down the road. And all of them will have different efficacies. They work slightly differently and will have different effectivenesses for different categories. So for example, a vaccine might be 95% effective against catching COVID or developing the disease, but 100% effective against preventing or to prevent death. And so one of the things we do need to get better at, especially with Johnson & Johnson having lower efficacy, is explaining exactly how well the vaccine works for different things, for catching the disease, for developing severe disease, and for hospitalization or death.
And if I could add on to what Dr. Avula said, what is important is for the 2-dose vaccines that we have now, that you use the same product for both the first and the second dose. And that's one of the reasons why it's really helpful for folks to go back to the same jurisdiction for their second dose where they got their first, because they'll get a dedicated allocation of vaccine to match what was given that first dose. But we have found some folks that are having trouble finding their second dose. If that's the case, if they can't get it where their jurisdiction was, then again, just give us a call or email us, and we'll work with you to try to resolve that so that you can get vaccinated within the recommended time frame.
Okay, excellent. I think the next question is mainly for Dr. Goodfriend. How is Loudoun planning to reach residents to ensure they get vaccinated in 2021?
Yeah, we are really looking forward to the time where we have vaccine and we're trying to find the people to get vaccinated. Right now, it's really just not getting enough vaccine, but within that, equity is always a critical component to what we do. So, while all of you in your elected districts are all touching on the best parts of Loudoun County, all over Loudoun County is wonderful. We do know that in western Loudoun County, it's a little harder getting access to vaccine. So we have reached out to pharmacies there to make it easier. We're reaching out to some of our low income, our immigrant populations to make it as easy for them to access vaccine now as to others. But we are keeping an eye on 2 months from now, 4 months from now, whenever Danny gets us enough vaccine, that we can say now, we really want to go out and make sure everyone can get vaccinated and deal with vaccine hesitancy. So we've built through this past year a really good relationship with our nonprofit organizations and with key leaders in the community. Because, and for those of you who touch on Fairfax, Dr. Gloria in Fairfax and her folks really have a tremendous outreach effort to their various cultures that may have a variety of different reasons why they may not want to get vaccinated. So we learned from her as we're going out to trying to deal with the misinformation related to vaccine. Part of it is, and some of you may know Mobile Hope, we've been in conversations with them to potentially have mobile platforms for going out to places to do vaccination. When we did our testing events, we had a really good model of going to our low-income housing areas and setting up events right in the squares. And again, when we're at a point when there's plenty of vaccine, that's going to be a great option. One of the challenges is it's a less efficient option than the large-scale pods. And right now, our commitment is whenever we get vaccine, we're getting into people's arms within days. So that's our main focus right now is those large-scale pods, and then how do we get those communities that are harder to reach to come to those larger-scale pods? And when I say pods, I just mean it's a large-scale vaccination site.
Dr. Goodfriend, I'm going to come back to you real quick with a kind of a question. So piggyback on that, I wanted to first recognize we have Senator Jill Vogel on the line now. Jill, would you mind telling us what district you represent and what part of the county, as you go out western? I know you have other counties as well.
Thank you for that. And I'm super grateful to have the opportunity to participate. And I'm grateful for everybody who's a part of this. I represent the 27th State Senate District, which is parts of Loudoun. And then it goes west, including all of Fauquier, Winchester, Frederick, Clark, a little bit of Stafford, and a little bit of Culpeper. And I can tell you that the number one most important issue for everybody is a subject we're talking about right now. And if I had 1,000 people doing constituent service in our office, we wouldn't have enough people to answer the questions that we're addressing tonight. So I'm super grateful for the opportunity to entertain all these questions. So thank you.
Okay, so thank you, Jill. I'm going to go back to Dr. Goodfriend. The question is, will we have mass vaccination sites in Loudoun? And if we will there be more than one? Can you elaborate on that?
Sure. And we do have one now. That's been in operation since December. We were fortunate that we were able to change locations. So right now we're at the Dulles Town Center. It's all by appointment. And again, the main reason for that is we've had very patient people waiting for a month now to get vaccinated. So we're trying to respect those who've signed up earlier. So it's all by appointment. But right now we're vaccinating probably about 800 people a day at that site with about 25 vaccinators. We can easily go up to 100 vaccinators when there's enough vaccine. And the goal will be, when there is enough vaccine, to have multiple sites that people can come to, and not just county run. You know, our hope is eventually you get to the point where you get your COVID vaccines the same place you get your flu vaccine or your tetanus booster, at your local pharmacy or local doctor's office. Right now, it's mainly through larger scale vaccination sites.
Thank you so much. I appreciate it. We have a couple good questions about schools. There's some concern about that. I would ask maybe if both of you could speak on that. I know Governor Northam gave his back to school order, and then in the Senate, we voted with SB 1303. That'll go over to the House as crossover. I don't know, frankly, if the House had equivalent to that basically says that all school districts in Virginia have to offer an in-person and virtual option. That won't go into effect until July 1st if it does pass the House. And it would really be a message for sending the kids back to school for next fall. So it gives us some time to do the vaccinations. So a couple of questions on this area is about schools. Can you just generally talk about what we need to open schools? Where do teachers fall in the vaccination pipeline? What happens if a teacher says no to being vaccinated? Will there be enough teachers? So I know I've dumped a few questions on you. I can circle back if need be. Dr. Avula, I don't know if you want to start us, and there's probably plenty enough to go around on that one.
Sure. So, I think the intent of the governor's comments this past week were really to encourage some type of return to school. And so that, that's still being defined district by district. Every district's going to handle that differently. Some will do a hybridized version. Some will have in-school return for special ed and non-English speaker students. So I think it's going to look different in every school district. But the underlying crux of the message is that the data consistently has shown us that schools that are implementing effective community mitigation strategies are really effective at minimizing the spread of COVID in the school setting. And so when we look at cases that are related to schools, cases happening for school teachers or students, those individuals are contracting COVID outside of the school and by and large not spreading it within the school. Schools are really good at not being places where COVID spreads. And so and that data is true here in Virginia. It's been true across the country and across the world as we've continued to look at data reports around schools that have been in person for much of the last year. And so at some point, I think at this point, really, we need to recognize that schools can do this, and we need to follow the data, and we need to be reassured by the data. And we all know that in-person school is going to be more effective for kids. And for teachers, frankly. So I think that what does this mean? Obviously, we want to get as many people vaccinated as possible. We want this to be as safe as possible, but it's not a requirement for return to in-person. I do think teachers are considered one of the priority tiers in 1B. Every community is going to be able to move through those priority tiers at different rates, depending on how many teachers they have in their community and how much vaccine is coming into their community. And so Dr. Goodfriend will have to talk more specifically about what that potential timeline looks like in Loudoun.
Yeah, and as Dr. Avula said, we have really good experience now over these last 6 months of schools operating in the COVID pandemic. And in Loudoun County, we've had some private schools that have gone through this with no problems at all. We had some others that did have very significant problems. And when we looked into it, it was the lack of mitigation strategies and mainly that 6-foot distancing between individuals. When that was not respected, then you'd have outbreaks, and they've evolved. Our public school system is very committed to doing this very safely. They have, each school has, I think, what I call an enforcer. I'm not sure what they're calling it, that's going from classroom to classroom to make sure that each class is following those mitigation strategies. And we work very closely with the school system so that if it does look like there may be an outbreak situation occurring, we'll be on top of it quickly with them. As Danny said, vaccination is reassuring to staff, but in no way is it necessary for schools to be in session. We've had, as I said, a lot of public school jurisdictions have been in session this whole time in a hybrid situation. In Loudoun County, for our public schools, they are essentially all done with their first dose vaccinations, and now we'll be starting on their second dose for everyone who wanted. And I believe is about 80% of the LCPS staff have chosen to get vaccinated. At the same time, we're really trying to prioritize our private schools, our home schools, and our child care facilities. Child care is a real challenge, and those are folks that we really want to get vaccinated, because it's much harder when you have an infant and toddler to maintain the 6-foot distancing than it is with a 10-year-old. It's also harder to have that type of regulated outreach to them, because there are a lot of child care facilities, a lot of private schools, and much smaller. So instead of having one entity of 18,000 or so staff, we have hundreds of entities with maybe a half a dozen staff. We really want to be able to reach out to them. So if any feel that their school has not been in contact with us and want to know where they can get vaccinated, again, email us, health@loudoun.gov. That really is a priority for us for everyone in that bullet. The 1B3 bullet that we're looking at, which is phase 1B of essential workers, we want to make sure we get them covered.
If I could follow into that, if you see, I've seen a few concerns on the chat that schools aren't following safety practices or what parents feel are safety practices. If you see that, please report it, either a phone call or an email to Dr. Goodfriend. You can also, that's the best place to go, but any of the legislators on here, we're going to be posting our contact information as well. We're a resource for you. But if we could point that out to Dr. Goodfriend, we will make sure an action is taken on that, because smart practices are a key point for us to stay healthy as the vaccination is rolled out. This one's probably best for you, Dr.
Yeah.
Oh, sorry.
We've had 2 additional positions that have been supporting our efforts, whether it's in schools or in businesses. If anyone sees an unsafe practice, let us know. And it could also be done anonymously. And we'll go and investigate. We do it as an educational tool for these entities, because many times they're just not realizing it's occurring. And we found that it's been very effective.
Thank you. Thank you. We really appreciate those. Are good questions. Dr. Avula, this one's probably for you. What comes after phase 1C workers, and when do we anticipate the general public will be able to get vaccinated?
So moving from phase 1C to phase 2 is the general public. Phase 1C workers, so 1B, I'm trying to decide whether I should show all this. So if you have interest in the details of each phase, you can go to the VDH website, and the way to get there is vaccinate.virginia.gov. And that will take you directly to this COVID-19 page, vaccinate.virginia.gov. And you can click on the details under each phase. So we're in phase 1B now, and you can look and see what the details are around who's included in phase 1B and then who's included in phase 1C. There are actually links to the documents that these were generated from. And so if there are questions about more details or the specifics of my situation, you'll be able to answer it at that site. So right now, as we're getting about 130,000 new doses a week, without a drastic increase in supply, we're going to be working through 1B for likely the next 2 to 3 months. So I don't anticipate us getting through 1B for 2 months, and 1C will likely take another couple months after that. And we will have more vaccine at some point. Like I said, we've got Johnson & Johnson on the horizon for the first week of March, likely. AstraZeneca potentially for the first week of April, depending on how their clinical trials go. But I think the general public, we really are looking at this early summer. Like I don't see us getting to the general public until this summer.
Here's another specific question, kind of piggybacks on that. Will children age 15 and below with moderate to severe asthma be eligible for vaccines in the near future with a health condition?
It really depends on the data. So right now, Pfizer is the only product that's approved for anybody under 18. It's down to age 16. They were also approved to open up their clinical trials back, I think, at the beginning of December for down to age 12. And so right now, at least the last time I checked, they were the only ones incorporating children into their trials. So I do think it's going to be, 4 to 6 months before we have enough compelling data for the FDA to make a recommendation around kids. So I wouldn't expect that until next school year at the earliest.
Thank you. I would like to know if you're required to obtain the vaccination in the jurisdiction where you live, or if you can sign up for somewhere else in Virginia.
Well, our intent, so right now we're in phase 1B, which means that about 50% of the vaccine coming into every community is going to 65 and up, and the other 50% is going to these essential work groups that I just quickly flashed on the screen. So police and fire, correctional officers and homeless shelter workers, teachers and childcare workers. The ideal scenario is where you end up going to a vaccination event aligned for, if you qualify as an essential worker, you're going to go through your employer, because your employer is who your health department is reaching out with to set up these events. If you qualify by age or underlying condition, you're going to go with your place of residence. Now, there's some nuance to that because different districts are handling it differently. So I'll let David talk about how that's playing out in Loudoun, but that's the general approach across the state right now.
Yeah, and our general approach is, if you live or work in Loudoun County, we want to vaccinate you. And even if you're not formally a resident, if you spend your winters in Loudoun County and your time has come up, we want to vaccinate you. We don't want to put up barriers to folks getting vaccinated. But that said, we do get our allocation on a per capita basis. So we are understanding that again, some folks are very frustrated and they're looking at CVS's in Pennsylvania and say, well, maybe I can drive up to Pennsylvania and get a vaccine because they want to get it today. Our preference is folks try to get it around where they live. And similarly, we are seeing some times where people did go very far away to get their first dose, and now they're stuck because they can't get a second dose. So we're trying our best to accommodate that because, again, even though we do have a limited amount of vaccine, we don't want anyone to get unvaccinated if they're a Loudoun County resident. So, we've had, from Danny's neck of the woods, we've had someone from Dinwiddie come up here to get vaccinated. But we said, well, you did it, but, we hope in the future you'll get your vaccine closer to where you live.
Two questions that kind of go hand in hand with what you just said. Are CVS, Walgreens, Costco, and Loudoun County getting more vaccines with this new rollout by the administration on 11 February? If so, will it go according to the county registration list, or will they have to get appointments separately on a first come, first serve with the facility or another location?
Well, maybe I'll give a little bit of background on the CVS situation because it's created a lot of frustration, understandably, for the entire state today. CVS first announced last week that they would be receiving 26,000 doses for the state of Virginia. They set out a press release, I think Tuesday or Wednesday of last week. We immediately followed up with their state leadership and basically said, hey, we are excited that you're bringing a new vaccine to Virginia because this is 26,000 doses above and beyond our normal state allocation. So really a great opportunity for us to pull more vaccine into Virginia. And we did that by activating the part 2 of the federal pharmacy partnership. They made the announcement. We connected with their state leadership the next day. And our goal was to figure out how do we make sure that Virginians who have already pre-register, that were already on the wait list with the Loudoun County Health Department, for example, can make sure that we're honoring their place in line and that we are making sure that they can get these opportunities to get vaccinated in the upcoming weeks. So we tried every way we could think of: password protected websites, mass uploads of our lists. And CVS kept, like, they were willing to work through this, but ultimately they couldn't come up with a technological solution that would allow for our folks to be prioritized. And it was really disappointing. And because I think there is the issue of fairness. We wanted our folks who had been on lists to be able to take advantage of those appointments. But there's also an issue of equity and access, because CVS's platform is strictly an online internet-based platform. And so for residents who don't have internet access or don't have an email address, or maybe are non-English speakers and aren't going to be able to interact through that's going to limit their ability to jump on a website at 6 in the morning and get a space. And so we will continue to work through this with CVS, but where that leaves us today is that they opened up their registration today for Virginia for appointments over the course of the next week. It'll be a rolling enrollment, and it's going to be limited to 65 and over. They chose a total of 36 stores, I think, throughout the state, with each store slated to do about 100 doses a day, and that will continue. We're expecting 26,000 doses a week and throughout the entire state. And then 3 to 4 weeks out, we will see other pharmacies come online as part of the retail pharmacy partnership from the federal government. And so Walgreens, Walmart, Publix, Giant, Safeway, there's a few other chain pharmacies that will create more access points. We are reaching out to them now to prepare for that, to figure out where do they fit into the overall strategy of vaccination. How can we start working on some of those technological solutions now? But we don't have a clear sight line on when that will come and how much vaccine they'll be able to offer.
Right.
And we likely your staff have been getting emails or calls from folks who are not all that excited about how this rolled out with CVS today. We tried our best in Loudoun County to honor that waiting list. It was frustrating for folks, one, trying to get in to the website, and then two, as soon as they get in, they realize all the appointments are filled. Because I think in Loudoun County, it went live at around 5:15, 5:30 this morning, and the appointments were all filled by 7 in the morning. So if you're not a morning person, you missed it, and that's for the week. But as Dr. Avula said, it would be terrific if places like Safeway and Giant start getting new vaccine, because we've already started partnering with Safeway in Middleburg, and they allow us to populate the appointments for them. So we take them right off the top of the people who've been waiting the longest. And in our discussions with Giant, they have that same ability. They've been doing that in the district and for a while now. So while, as Danny said, any additional vaccine is a good thing, it really would be much better if it's able to be tied while we have this waiting list to people who have been so patient.
So, Dr. Goodfriend, there's a couple other questions here in the chat that are kind of related to the Dulles Town Center vaccination site. And one of the questions, and they're kind of related, one part of the question is, how would someone go about actually arranging to get an appointment there? And then the other one is, what happens if I show up without an appointment?
Yeah, so fortunately that doesn't happen that often, and we appreciate that. Because we can't give vaccines to people without an appointment. It really would be unfair to those who've been waiting. And we only have a certain amount of vaccine that's available each day to give out. So each day we do turn away some folks who just walk in. But if people have not pre-registered yet, please sign up if you're in a 1A or 1B category. Because even if you're not in those top 3 bullets that we're able to vaccinate now, eventually we'll get to all 9 bullets. So you can submit your pre-registration survey now. Again, they could either email us at health@loudoun.gov, go to that phone number, 703-737-8300, or go to loudoun.gov/coronavirus, and that'll give information as well. We really want folks to have access to the vaccine as quickly as possible, because everybody in 1A and 1B is high risk. And we really want to be able to do our best to get to them as quickly as possible. But also understand there are other resources now with CVS and potentially others. So if that's available to them and it's quicker, please do that as well.
And Dr. Avula, there's a question in here, and I think it's kind of a more general kind of question about how many doses was Virginia originally allocated? How many are they getting now? And how is it determined how many Virginia gets, and then how many does Loudoun County get?
So probably 4 weeks ago is kind of the best data I have. I don't know exactly what our weekly allocation was prior to that, but the beginning of January, we were about 105,000 doses per week for the entire state. By the third week of January, that has just increased in bits. So we went from 105 to 122, and I think our allocation this week was 129, and those orders will go in by Thursday night, Friday morning. So that's what we're anticipating for next week. The allocation methodology has well, let me start with the first 3 or 4 weeks. It primarily went to hospitals and health departments that could store the Pfizer vaccine or could turn out large amounts of vaccine. And so if you look at the distribution from the beginning of this, from kind of December 18th to the first week of January, the vast majority of that went to hospitals. What has happened since then is that the capacity to receive, store, and administer vaccine has grown up around the entire state. And so many of those hospitals that were receiving vaccine early on stopped getting such large amounts because we had to distribute it to all of these other places that now have the ability to receive and administer it. So 105,000 up to about 129,000 new first doses per week as of this week. That in addition to that, we get second doses that correspond to the orders from 3 or 4 weeks prior, depending on Pfizer or Moderna. So ballpark, we're getting just under 200,000 first and second doses for this upcoming week. And then in addition to that, this new 26,000 doses from CVS. So that's being allocated separately from a different pot of vaccine from the federal government. So of the amount that we have control over, let's take the first doses that come into Virginia. We are kind of identifying a few top line priorities. So for example, these last 2 weeks, there are a number of congregate care facilities, independent living facilities, group homes with individuals who have intellectual or developmental delays that fell outside of the federal pharmacy partnership with CVS and Walgreens. They were primarily doing licensed assisted living and nursing homes. And so all of those other congregate senior facilities that were not included under there, we've been taking vaccine off of the top of our allocation and really routing it to those communities to make sure that we get 1A done across the state. Another slice off the top over the last 2 weeks has been the Department of Corrections, because if you look at our tiering of 1B, it's the correctional officers around the state fall right in that second bullet. And so, first we did like Virginia State Police and now Department of Corrections. And so there's another, I think this week is about 5,000 doses that went to Department of Corrections. And then after that, the bulk of what's left gets distributed by population to the localities around the state. There's a couple of specific exceptions to that. So when we looked at, and I'll actually share my screen to show this as well, when we look at the distribution of doses administered, so this is maybe of interest to you all too. If you go to vaccinate.virginia.gov, it takes you to the site. You hit vaccine dashboards, and you'll see our summary dashboard that shows Today, we've had 1,130,000 doses administered. And then you see a map of Virginia where you can hover over and look at what are the total number of doses and the total, the rate of doses per population. So here in Loudoun, 40,600 doses administered. That's a rate of about 9.8 per, 9,800 per 100,000 population. So the reason we provide it in rate is just so you can sort of look at relative vaccination rates among different localities. So one of the other things we're really trying to do is true up communities where you have much lower rates of vaccination. And so you look down here at Prince George, they're 3,000 per 100,000, Dinwiddie, 3,300. So there's a few communities that really, because of vaccinator capacity, or they don't have health systems that are really serving their areas, are really significantly underserved. Here's another one, Cumberland County. So we're trying to take a few hundred doses or a couple thousand doses and really trying to even out the geographic distribution. And then we also know that our African American and Latino Hispanic populations are at higher risk. And so for communities that are actively pursuing, events for the elderly African American population right now, we're reserving some doses for them as well. So what does that mean for the rest of the communities? It means that about 100 to 110,000 doses end up getting distributed based on population. For Loudoun, that's probably 6,000 doses a week, and it'll go up slightly. And one of the clear things that I've heard as I've talked to my health director colleagues is that we really need to have a more clear justification for that distribution. Like, it's one thing to just do it based on population, but as we start to layer on these different lenses of geographic equity and racial equity, how are we actually defining that? Because, as David will tell you, there are clearly underserved populations that are in Loudoun as well. And because Loudoun has such a large population, there are actually more of them. And so we are tweaking our algorithm to kind of take all of these things into consideration. And I think in the next week or so, every week is going to change. Like, we're going to learn from how we're distributing vaccine, but we do need to make sure for local leaders and elected leaders that you guys understand how this is being distributed and what that means for your community. So anything else you'd add to that, David?
No, I think that's a great answer. And we had a very good discussion with Dr. Underwood, who's in charge of the Chief Diversity Officer for the state, because we know in Northern Virginia, it's a very diverse population, a very challenging population, given that at least in Loudoun, 1 of every 4 folks are from another country. And how do we best reach those populations? And as Dr. Avula was mentioning, if there were vaccines set aside, at least for us in Loudoun County, for our senior immigrant population, because we know we have a lot of South Asian mother-in-laws and father-in-laws that are living here, and also from our Spanish-speaking population seniors. So, we can definitely target that vaccine to them as well.
Great, thank you. This is amazing information. Dr. Avula, I can tell you've done a few of these the way you pull up that website so quickly, so very impressive. I will tell you on the chat line, if you're on there, we've been posting contact information for Dr. Goodfriend. We've posted the link for the VDH website as well. And when we're done with this, with the teletown hall, everyone who registered will get an email, and it'll have all that contact information and those links. So you're going to get that information again. The next question, I'm just going to, if Dr. Goodfriend, I'll let you jump in if you want, but I probably answered the question. I'm 72 years old, registered Loudoun County, still no appointment for vaccination. How soon will I get my vaccination? Unfortunately, this person's a little stressed and worried about it. I understand. I would recommend you use that number and call Dr. Goodfriend's office, and we can he can work. His team can work with you and get that scheduled. That work, Dr. Goodfriend?
Yeah,
okay.
Definitely. As Dr. Avula said, we're devoting half of our vaccine to those age 65 and above. We have 26,000 people in that category on our waiting list. So at 4,800 doses a week, it's going to take a while. We're now up to those who registered as of January 13th. So if folks know when they registered, at least you'll have some relative knowledge of where you may be in the list, but definitely don't hesitate to email us or call us.
Yeah, I would just, the Dr. Goodfriend and his office, they'll do anything they can for you. And obviously a ton of resources on the VDH vaccination website. Please don't stay home stressed about this. Call and we'll look for some answers, or if you're unable, call any of our offices and we'll work that. Next one, this is probably Dr. Avula, but of course you can both team on this one. There's some concern that some of the publicity about is all the vaccine from a vial being used, or if any from a site is not being used, can it be sent to a CVS and be used? Can you just address, is it all being used? What are we doing about that?
Yeah, so the vials of Pfizer, typically they were originally rated for 5 doses per vial. What we found in practice is that you can actually get a 6th dose in terms of the total amount that's delivered on each dose, and that is really consistent. So in fact, next week, when the federal government starts to distribute and count the number of doses that they're giving to each community, they will go from what was a 975 dose unit, the package that Pfizer comes into, they will start counting each vial, instead of 5 doses, 6 doses. So that'll be 1,170 doses. To ensure that they can do that, when they ship out those packages, they will come with the right type of syringe to allow you to maximize the extraction from each of those vials. The Moderna are 10-dose vials. There have been occasions where people are able to get an 11th dose out of them, but not consistently enough. And so I think what I have heard is that Moderna, in terms of from a production standpoint, will start to put more vaccine in each vial. So they may actually be able to pack up to 15 doses. So we're waiting more to hear about that, but that may be another way to increase the total amount of dose production coming from Moderna and Pfizer. So what does that mean for waste? You know, I think a lot of places, when you get down to the bottom of the vial and you have 2 or 3 doses left, they're often looking to staff or other individuals who may be helping with an event. We really are not trying to waste any doses, but occasionally that happens. You get to the end of a clinic, you get to the end of a vial, and you can't store that for the next day. And then you are required to report any waste to the CDC through a system. And you can see the link on the VDH website of how to report that. Now, there are occasional accidents that happen too. This is a very fragile vaccine. And so if you drop a vial or shake a vaccine vial, you're no longer allowed to use that. And so there have been scenarios where we've lost vaccine because of those accidents, but they're few and far between.
And to Dr. Avula's point, it's one of the reasons, unfortunately, that we are a bit limited in how we distribute the vaccine, because we want to make sure that to the greatest extent possible, no dose goes wasted. And it's a lot easier to do at a mass vaccination site where you're doing 600, 800, 1,000 people, and I think every health department has gotten amazingly good at figuring out when to go from 10 vials being used to 5 vials to that one last vial, and how do you find those backup people that you can give a vaccine to so that you don't have any wasted. The more we get it out into the community, the more likely it is that 10-dose vial, the pharmacist may only be able to give 8 doses within the 6 hours that you're able to use it. So it does create some access issues by limiting the number of providers who are giving vaccine. But as we talked about before, it's just every dose is so precious right now.
So Dr. Goodfriend, kind of a follow-up to that, because there was a question in the chat about how has the weather, I mean, specifically the snowstorms last week, and I believe the forecast for the upcoming week, how have those affected what you were doing, and how does it affect your planning for the upcoming week?
And that's the silver lining of the limited vaccine availability is our capacity at Dulles Town Center is so much greater than what we're doing now, that if we close down a clinic due to snow, we can get those folks into other slots later in the week. That's not the limiting factor. And fortunately, that's a great partnership we have with our emergency operations folks. They're terrific at predicting the weather, knowing when it's a safety issue, and telling us when to close. and then we work with them to send out notifications to all the people who had appointments, cancel their appointments in VAMS, which is the system we're using now, and then open up more slots for them to get their vaccine. So you know, right, as I said, right now we're doing about a quarter of the capacity we can do at Dulles Town Center. So it's very easy for us to reschedule folks.
Okay, good, thank you. And another question from the chat is in reference to people being able to identify that they have an underlying condition as it relates to 1B. How do you go about verifying that, or what type of information do they need to provide to be able to confirm that they do have an underlying condition and meet the 1B status?
In Loudoun, it's really, we're trusting people, to be honest with us. We don't want to be in the position of reviewing people's medical records. I think the only thing that easily we may verify is age for the age-related individuals. And my sense is, to a very large degree, that if someone is saying they're 16 to 64 with an underlying medical condition that puts them at increased risk, they do have an underlying medical condition. And for those few who may say, well, oh, now I know I don't need to bring documentation, we are in a position that if you take someone else's spot, you're taking a high-risk person's position. And we're really in the business now of trying to keep people out of the hospital and trying to save lives with the vaccine that we're giving.
And I'm going to cover one more before I turn it back over to Senator Bell. There was a question in here about how are you, specifically in Loudoun County, able to do outreach and address those individuals who are homeless?
Yeah, so homeless folks who are in shelters are a very good targeted population. We actually had a very good pod day with folks who came from our homeless shelter. People who are homeless and out in the community are tougher to reach in general. The other part, which really is a tough issue now, are the homebound individuals who are high risk because of medical conditions, but they can't come to a pod, can't come to another site. And I don't know, Dr. Avula may have a great answer for this, but right now it really is challenging trying to come up with an answer for these populations because we have that 10-dose vial and we've got 6 hours to use it. And so going from home to home easily may mean that we're not able to fully utilize all the doses in that vial.
Yeah, I think it's really important to understand some of the logistical challenges in getting to hard to reach populations. Some examples I've seen around the state are where you have an anchor of a mass vaccination event, and then you tap faith communities, having church vans bring individuals to the event. One other thing we're pursuing right now is that DMAS, the Medicaid program, will actually pay for transportation for those individuals to come to an event. And so they are culling their lists of their high risk dual eligible populations, and then starting to figure out, okay, what are the upcoming events in their communities we could get them through to, and can we arrange transportation to get them there? So it is an administratively cumbersome outreach, but given so many of the challenges around how we get doses and how we move them, that's going to be the preferred option right now.
Yeah, and to Dr. Avula's point, particularly the disabled population is really a high priority for us. And so if folks are finding challenges getting to the pod, we want to know about it and work with them. We've got some really good nonprofits that can support that, but we don't want anyone to be left out because of challenges getting to the pod. If they truly are homebound or homeless and can't come to the pod in one way, then that's something we're struggling with. But other than that, if that's critical for us, and we do have some very good advocacy groups and support groups in Loudoun County for these populations that we're more than happy to work more with if that's an unmet need.
Unfortunately, we're coming up on our 7 o'clock hour, and our Zoom may be dying any moment now. So just in case, what I want to tell you is we've got all the questions on chat. Those that we didn't go, we'll try to get you some answers. And like I said, we'll be emailing resources out from this. The last one I was going to hit real quick, we'll need one of those quick 30-second type answers if possible. Dr. Avula, is there any differentiation if someone has a more severe risk profile that you would give on the Johnson & Johnson versus the Moderna versus the Pfizer?
Yeah, really interesting question, and something we're grappling with right now, because the Johnson & Johnson vaccine, at least with their initial data, shows it's only 66% effective versus contracting the disease. The data looks pretty good for preventing hospitalization and death, but it is going to raise those questions. And so right now, I just on a call with the National Governors Association this morning, several governors around the country raised this question, asking the federal government to provide more specific guidance. We as a state have had our vaccine advisory work group look at the safety profiles and are currently coming together with a recommendation. I mean, I think we've got to balance. More vaccine is better. Like even 66% and then, close to 100% on hospitalization is going to be better than nothing. People should know what and have a choice about what they're getting. But we could also see a scenario where we're using Johnson & Johnson more expansively on a younger, healthier population. So those essential workers who are perhaps 50 or under or 40 or under. So we're going to work that through the policy group here at the state and should have an answer in the next week or so.
So everyone, thank you again for participating. If you have other questions we didn't get to, if you would respond back to the contact information that we're going to send out. I'd ask everyone to please continue to social distance, wear your mask, sanitize. We are not there yet. We see light at the end of the tunnel. The last thing I wanted to pass on that I was asked to do this by our state police is if you do not have a reservation, please don't go and try to force your way into the vaccination sites. Our healthcare providers are doing their best, and we're going to work through this. It's being done in a very fair way. Hopefully the transparency you see here from the website, but our healthcare workers have a huge challenge, and we don't want to have a security challenge as well. So we ask everyone to please follow this. And if you're concerned about not getting your vaccination, please reach out to the contacts we're going to send you and we've given tonight so we can make sure that, that we do this fairly. We do want to address your concerns, but we don't want to do it in a way that's going to add another burden or slow down given these vaccinations.
And Senator Bell, can I add one thing?
Sure,
I would just tell you to that point, we've had so many people reach out to our office and say that they've stood in long, long lines for hours at a time. And that's the logistical challenge and the frustration. And to your point, rather than go to a vaccination site and wait, it's much, much, much better to reach out to one of our offices or to the numbers that you're going to provide and get in the queue and let us help with that registration process. Or if you can't access it online, we are available to help with that and can help people. If you call us, we can often walk you through that process and help you do it online and avoid doing it the more difficult way. And I know people are so impatient and we really sympathize, but going to the vaccination location has been a real challenge and is not the right solution at this point.
Thank you.
Senator Bell, I just want to mention some of the other Northern Virginia jurisdictions, and I think Loudoun is part of this group. It really helps if you can periodically let people know the status of their registration because they get so anxious. They registered 4 weeks ago and they feel that their name has fallen off the list or they should somehow show up somewhere. So if you can have some intermittent communication, I know it's a challenge, but that would help.
Yeah, I also would point out on our social media websites, the VDH websites, please check those because we all are putting out that kind of information very regularly. Yep. If we have it, we'll share it. And if you have questions, again, ask us and we'll try to research or get in touch with those we can. Since it hasn't died yet, if everybody has a few more minutes, we can do a few more questions. One, I don't know if this is possible or not, because I know you have a waiting period after you have the vaccination to make sure that there's no reactions. Some people have asked, can we have a drive-through vaccination site?
Yeah, and we do have a model for drive-through vaccination. I think the question would be now, at least in Loudoun County, would it add value over our Dulles Town Center site? Because just like you said, we're really putting effort into watching folks for that 15 minutes plus after they get vaccinated, make sure everybody is safe. There have been some reports of reactions. We haven't had any serious ones in Loudoun County, but we don't want anything serious to happen. And we know that for drive-throughs, while we've had reserve areas for people to spend their time, it's hard to enforce it, and you'll have people pulling out. And for me, just with our last seconds, just want to thank you for hosting this. And anytime you want me back, please ask me. I think it's critical to get the information out. The other piece, and I think you mentioned it, was the mitigating steps that have gotten us here safely so far remain critical. That we got to get through the winter where our numbers are high. And also, even if you've been vaccinated, wear your mask, keep your distance, keep your bubble. Because as Dr. Avula said, we still don't know the extent to which the vaccine keeps you from getting infected and being infectious versus keeping you out of the hospital. And we don't want you to inadvertently pass the virus on to somebody else because you think you're immune.
There's one more topic that I think it's worth bringing up here, and it means we've really got to double down on the mask wearing and social distancing, which is the introduction of these new variants. You all have probably heard that there's a UK variant and a South African variant. We've identified them in the United States. As I've talked to colleagues in other parts of the world, I was on the phone last week with my counterparts in Israel. They are seeing about 80% of their cases right now are the UK variant, and that happened within the course of a couple months. The CDC is modeling and projecting that UK will likely be the dominant variant for us here in the United States by the end of March. And so the vaccine appears to be effective against the UK variant, so that's the good news. We're still awaiting more data on the South African variant, but it makes it more important than ever as we're in these winter months that we really double down on our mitigation strategies.
A question real quick one that came in is, what are people with who speak Spanish or have other language needs? Where can they get resources?
So in Loudoun County, we have a Spanish language coronavirus page. Please go to it. We also send out text informations, both in English and in Spanish. We always have a Spanish speaker available at our call center and at our vaccination site. In addition to that, we know that there are lots of other languages that are spoken in Loudoun County. So if there are communication issues, we always have a way to get an interpreter on the line. We don't want language to be a barrier for anybody.
Thank you. I'll also point out, if we have people who are hearing impaired, sight impaired, if you will communicate with someone, and then any of us here on this panel, we will find a way to get an interpreter so you have information. So thank you for that. Any of the panelists have any final words or questions that you've received a lot? That would probably be helpful as well, because I know we get a lot of questions. Senator Favola.
Thank you, Senator Bell. One question has come up, and I know I've emailed Dr. Avula, but he's wildly busy. One portion of my district is Arlington, and it's, as you know, Arlington has a very large workforce proportionate to its population. I mean, it's like a 60% increase in population during the workday. And we don't seem to be getting an adjustment in our vaccine supply to accommodate the workforce vaccines that we're actually distributing. And I'm getting a lot of pushback from residents. And I'm expecting that probably some other senators are too, if they're in these job center jurisdictions where the vaccines are going out more. At least the perception is that more vaccines are going to the workers than folks who actually live in the county.
Yeah, sorry that I haven't seen that email yet, but I'm getting to it. But you got me here, Senator Favola. So I think, earlier when I was talking about how we need to add layers to the distribution mechanism, this is one of those examples. I think that's true for the DMV. I think it's also true for Richmond as we start to work down through the essential groups. There are a lot of people in state government that work in Richmond but live in outlying areas. And so we will likely, depending on where we are with the essential worker tiers, we'll likely have to make some adjustments in distribution based on that volume. So it hasn't happened yet, but I think as we get done with our long-term care facilities and then start to codify our allocation mechanism for racial groups, essential workers will be right behind that.
That would be great. And of course, in my case, I have many workers who live in Maryland and DC. So we have that little overlay. But thank you for thinking about this.
I think
Dr. Goodfriend, I just wanted to again say thank you for everything that you've done and that you have provided as far as this information. I'm assuming, but I wanted to ask you this question, is that through the course of doing this, you have probably had to increase your staff to be able to address this, because I know that when we had early issues with unemployment insurance, that VEC had to significantly increase their staff. And I know that you've given out the phone number and the email address, and you've talked about having different language people available to be able to help. Could you just share with us what additional resources you're bringing to bear to be able to actually implement this in Loudoun County?
Sure, and actually, we have brought on a good number of case investigators and contact tracers. We've brought on some other key positions, but other than that, not many. Because then the main reason is twofold. One is this is an all-of-county government approach. So if you go to our vaccination site, you will see people from multiple different departments that are working on this. Our phone center is run by the county's public affairs folks now that took it over for us. Every department has this as a priority. In addition to that, our Medical Reserve Corps has been amazing over the past year. They've put in about $800,000 worth of time towards this effort. And I'd encourage folks, if they're interested in volunteering, go to loudoun.gov/MRC. We could always use more volunteers, both medical and non-medical, to support this effort.
So that's really good to know that you're taking this kind of total, county government approach to this, and you're applying the resources that are necessary to be able to make this as successful as possible. I mean, because I was a little bit worried when you were giving out the email and the phone number that there was not just one person on the other end of the line, but it sounds like that you've got it well thought out.
Yes, right now we have about 20 folks doing our phone line. I'm actually our email person, and that seems to be working well. So, folks, if you email health@loudoun.gov, you'll probably get a response back from me. But under our county administrator, Tim Hemstreet, our county board of supervisors has been very supportive throughout this whole effort. And it really is, from my perspective, very heartening to see that whether it was the pandemic we have now or whether it was Ebola or H1N1, the county views this as how do we protect our residents and our employees? Not that this is a public health issue or it's a state issue, but it's a how do we protect our folks issue.
Yep. Real quick, thanks you to all the people who are offering to volunteer on different skill sets. I'm sure we need everybody. So thanks so much. And I would encourage you to follow up afterwards. Delegate Murphy, I think I saw your hand up. You have a question.
I just, we have heard from a lot of people that you can sign up at CVS to be someone that's called at the end of the day if they have an extra, vaccination or something, because they have to use it or lose it. And if you live within 5 or 10 minutes away, they'll call you and you can get over there. Is that actually accurate?
I don't know yet. They don't actually start vaccinating until Friday. Stephanie Wewell, our state pharmacy director, did ask them on a call yesterday to provide what their wait list plan is. I just haven't seen it. So what I will do, you guys are getting those bi-weekly updates, the partner updates. As soon as we get that confirmation, I'll make sure Craig puts it in the next bi-weekly update.
Yeah, thanks. That'd be really helpful. Thank you for this. This has been great.
Delegate Gooditis, I think you have a question?
Yes, Dr. Avula, Dr. Goodfriend. Someone approached me and told me they work in a healthcare setting and they're horrified to discover they were very glad to get their vaccination, but they're horrified to discover that many other people who work in that healthcare center are not getting the vaccine. They're afraid, misinformation, ridiculous information. And I know right now there's no shortage of people who want the vaccine. So it's, in that sense, it's not an issue now, but we have many people apparently in healthcare settings who are not getting the vaccine. Is there a continued effort on education, or is that up to the individual organization?
There are ongoing efforts around, different population groups. I would say most of those educational efforts have been focused on African American communities, just because we know, and that's where we're seeing a lot of the vaccine hesitancy come from. But that's not. It goes beyond that, right? And so, the only other effort that I'm aware of that's happening right now is teams of folks going to long-term care facilities, because what we saw in long-term care facilities with the first round of vaccinations, you had really high uptake by the residents, like 80% uptake by the residents, but only around 30% uptake by the staff. Similarly, in healthcare institutions, I would say, they got allocated 100% of the doses for their staff, but probably only saw around 60% uptake among various healthcare workers. So it's clearly a need. We have not been as involved with specific organizations, at least at the state level, outside of efforts with the African American community and with long-term care facilities. I don't know if there are local efforts underway.
And we've been working with our Spanish-speaking communities. And again, going back to with Fairfax, if any of you have worked with Dr. Gloria Aruyensu, she's got tremendous stories of all the various cultures in Fairfax and the misinformation, unfortunately, that they're being fed, a lot of times back from their countries of origin. So she says you'll go to some of these houses and there are onions in the bathroom to keep you safe from coronavirus. There's concerns about, I think, aluminum in the vaccine. So it is an ongoing challenge that we're trying to work on. But what we hope is, as Dr. Avula said, is to get to the point where we can focus on vaccine hesitancy and not just how do we get shots in arm with the few vaccines that we have.
So last question, if we can. Promise this is it. Last one. We won't ask you to stay anymore. One of the questions we got is, as we have vaccinated in some areas, even though the numbers are low, can you see that it's having a positive effect on decreasing infections?
Well, it's hard to apply causality just yet, right? I mean, we've really been hard and fast at vaccinating probably for the last 3 or 4 weeks outside of the hospitals and long-term care. We are seeing decreasing rates of COVID around the state. We had really astronomically high rates in Southwest, and you've seen those rates start to come down, and that's true across the state. Now, is that a result of vaccination? It's hard to know just yet. I mean, I don't think there's a causation or a correlation of rates that have had communities that have had higher rates of vaccination having a more rapid decrease. I think we'll just have to wait and see how that data plays out.
So the conclusion here is I think on the chat, there's a fan club for both of our good doctors here. You're very popular. We thank you so much for your public service and the great job you're doing. I know you have a very tough job. It's been a hard more than a year, but thank you. God bless you both for what you're doing. We sure appreciate you. Thank you everyone for being on the town hall, those who participated, listened, gave us the great questions. And I want to thank our staffs real quick for putting this together. I know it took a bit of work to do that, and all my colleagues from the General Assembly for being part of this. So thanks everybody. And again, watch your emails, it's coming through. And again, if you have a question, if you're stressed about something, let us know. We will help you and we will get through this. And if we need to have another one of these, our good doctors, now that you have this massive fan club in this area, you're going to be here again, right?
Absolutely.
Anytime you want.
All right. Thank you so much. We love you. We appreciate it. Be safe, everybody.
Thanks,
Bye.
everyone.
Good night, everyone.
Good night.
Good night.